1 month ago. Today, City Council, we voted to extend the local emergency declaration, and we implemented aggressive measures to blunt the progression of COVID-19 and avoid overwhelming our healthcare delivery system. And it was 30 days ago today that the restrictions were placed on our restaurants, bars, and clubs. Our efforts appear to be working. The social distancing and the stay-home, work-safe order are making a difference and are saving lives. But I also want to make clear that we are still going through the storm, and we are not yet out of the storm. I know Governor Abbott made an announcement earlier today about phasing in the reopening of Texas. I certainly look forward to hearing more of the details, and we are assessing even now the things that he had to say and his executive orders. In the city of Houston, we will continue to take those necessary steps to protect the health and safety of all Houstonians and take those necessary steps to save people's lives. I can tell you without any hesitation that the steps that the city has taken, and when I say that, I'm including Houstonians in terms of staying home, engaging in social distancing, wearing the face coverings, all of those sacrifices that you have made, they are working. They have saved people's lives, if not your very own, and at the same time, they continue to save lives. We have yet to reach our peak. We are still in this storm, but all the signs are looking, and I'm cautious, let me put it this way, continue to be cautiously optimistic. And again, when I'm looking at the daily reports coming from our hospitals, it is in every indication that the hospital systems are able to handle the caseload that are coming into our hospitals, and especially in terms of beds, ICU beds, and ventilators. But let me just say this: if we take our foot off the brake, we can easily start moving back in the other direction. And Dr. Pearce and I, we were talking about, I think it was Singapore, that did the same thing. They significantly eased their restrictions, and then the cases started to spike. And the reason why I say this, over the last 30 to 40 days, we have asked Houstonians to make major sacrifices, to change their normal behavior. And it has not gone without a great deal of pain. The last thing I would want to do as the mayor of the city of Houston is to change course too quickly, and then we end up seeing things starting to spike. I'm also very, very sensitive to the vulnerable communities, at-risk communities, populations in the city of Houston. We will continue to focus on protecting our most vulnerable Houstonians, and those are people within our city who are living in underserved, under-resourced communities, people in our city who have underlying medical conditions, heart disease, lung disease, diabetes, obesity, sickle cell, recovering from cancer, a weakened immune system, senior citizens. These are individuals that I'm very, very, very sensitive to, and quite frankly, we haven't had enough conversation. And though everyone is anxious to open up our cities and get back to business as usual, the reality is for these vulnerable populations, they were living at the margins before this coronavirus. They're still living at the margins right now. And of all of the 31 cases where people have died in our city, all of them have died from underlying medical conditions. So it's very, very important that we continue to focus on them. And that's why next week we'll be bringing the task force that I have put together to discuss ways in which we will continue to provide education and provide resources to these at-risk, vulnerable populations. And as we think about moving forward and opening up our city, we can't just do it taking into account any one group or one individual. We must take into account our entire city and the diversity of our entire city. And I'm not just talking about ethnicity or religion. I'm talking about the social economic status and the health disparities that exist within our own city. On Monday, I will name a local leader to help lead the city's recovery, and I'll say more about the city's plan to reopen the city as we can now move forward, and that announcement will be made on Monday. For now, I anticipate that we will leave some restrictions as we move forward in place, even through the end of May, and that particularly referring to city operations. And that's including the cancellation of city-sponsored and permitted events. That will continue to go through May. Some city employees will continue to telecommute and work remotely. Quite frankly, the way we are operating right now, those operations will continue to exist through the month of May. What I want to ensure people is that as we move forward, just like we took very measured steps at the very beginning of this process, from the first week in March, then to March 11 with the rodeo, March 17th with restaurants, clubs, and bars, March 24th, the stay-home order. It is important that we take measured steps as we move forward. And those steps should be based on the facts, the medical advice that we are receiving, and that we do it in a very, very measured way as we move forward in reopening our city. To help control overcrowding at city parks, for example, for this weekend, the Parks Department will limit access to parking lots adjacent to the parks. Because again, we want to make sure that we're engaging in social distancing, and we'll continue to employ the same measures that have worked for us over the last 40 days. Parks will remain open, but parks that have gated parking entrances will be locked Friday night and unlocked Monday morning. The goal is to encourage citizens to walk and/or bike to their neighborhood parks. It will also minimize gatherings, driving, and parking at our facilities while keeping the parks open. And before I open to questions and bring up Dr. Purse, I want to briefly thank Aramco Americas for donating 30,000 K95 masks to the City of Houston's Health Department, which arrived today. I also want to thank Tito's Vodka. Instead of distilling liquor, it is making, some people are disappointed, instead of distilling liquor, it is making sanitizer, and today dropped off 130 cases of sanitizer for the city. Both donations come at a critical time when efforts focus on flattening the curve of the virus and protecting lives, protecting police, fire, health, and City of Houston employees who are on the front line of responding to this pandemic. Now let me yield to Dr. Purse.
Thank you, Mayor. And as the Mayor pointed out, as he gave the numbers today, for those of you who have been following our numbers, we had over 100 new cases today, and that is in the neighborhood of what we have seen before, which if you want to use the concept of a curve, and we've used the analogy of a speeding truck and applying the brakes, what might be happening if once we get to a point where the numbers are relatively consistent, that would be when we have got this truck going at the same speed. It's no longer accelerating, but it's still going at the speed. Now let's imagine that's probably 85 miles an hour, because with 100 and something people being reported as being infected, clearly we've not slowed down. And in addition, we had more deaths to report. So as long as that's continuing, we continue to have a problem. And we're sort of getting our hands around it. And as time goes on and we start moving forward, I think one of the concepts I'd like to get across to the public today is that as an emergency physician, I treat one patient at a time, and I can advise that patient that they need to take this medication at this dose at this time. And when they leave the emergency department, they will get that prescription filled, and I anticipate that they will take that medication at that dose at that time. And if they do that, I have been able to tell them what they can expect to happen. And if that doesn't happen, they need to come back to me. With public health, it's not entirely a different concept. We are advising people about social distancing and wearing the mask And if they do that, here are the expectations of what you can expect. But the patient, as a community and also as an individual, needs to follow the prescription and the directives in order to get the achieved results. And so as we look forward to society and actually the economy being restarted, I don't know that society is necessarily going to get back to the way it was as quickly as you'd like it to, but the goal is to get the economy going again, which is critically important. We still need to do all of the things that we were doing before. Otherwise, as the mayor pointed out, it's like taking your foot off the brake at this truck that's already going 85 miles an hour and wants to accelerate. The accelerator remains stuck. The virus continues to want to spread. And for all those folks in the community who have not been infected and have no immunity, that's the fuel for the virus. So I try to use these analogies to get concepts across so that people can understand our situation, because it's vitally important that we continue to take the medicine as it's prescribed, when it's prescribed, in order to get the results that we hope to have sometime from now. Thank you, Mayor.
Chief Pena.
Thank you, Mayor. Thank you, Mayor. So I want to start my report by providing some positive, very positive information here. We have very, very, very good news about our captain that was in the ICU, Captain Capistran. He has now been released from the hospital, and he's recovering at home. So I want to thank the community. I want to thank everybody who offered their prayers, and thank God that he's looked favorably on the Capistran family. In regard to our numbers in quarantine, we continue the trend downward as far as personnel in quarantine. Today we are at 62. As you can remember, as of the 8th of this month, we were up at over 220 firefighters in quarantine. So we're making excellent progress in lowering the number of people that require to be quarantined. I want to thank Mayor Turner for the continued support in my request for expenditures for additional equipment to keep digging that fire break, so to speak, to ensure that we are protecting our firefighters from additional exposure. Recently, as you may have seen in the news, we implemented a new spray decontamination process. This is an enhancement to what we have been doing in the last month or so. And this is going to allow us to better disinfect the working environments and the apparatus and the equipment that our firefighters are working with, which is going to help lower the amount of exposure. In regards to positive tests for COVID-19, in the course of this operation, we've had 29 firefighters who have tested positive. 19 of those have since returned back to work. We have 10 currently still recovering at home. The occupancy task force, we had a slower night last night. We have 52 complaints of personnel not adhering to the stay-home order. We have gotten voluntary compliance, let me say it that way, from every one of the business owners, which is a positive thing. We appreciate the assistance from the community. We understand, as the mayor mentioned, that there is angst to get things back open. But in our enforcement, we found very good compliance, voluntary compliance by the business community, and for that, we appreciate that. So that's my report, Mayor.
Thank you. Chief Oscillator.
Good afternoon, Mayor. Thank you very much for your continued leadership and everything you're doing for our city. The couple areas that we want to start off with, I want to report that Officer Ray Cervantes is still in the hospital, still hanging in there, but still not out of the woods. And the family, once again, wants to thank the community, the Cervantes family, for your continued prayers. And we have hope, and just 10 days ago we didn't have hope. So please continue to pray for him and everybody impacted by COVID. The other thing I want to report today, the only change we have in terms of our folks that are out on COVID exposure is we hold at 37, but we have another person back up and released to work today, which is good news, and I think that brings us up to 17 that have been released back to work, and we're down to the low 70s as it relates to officers in quarantine. The other area that we want to bring up to everybody very quickly is the area, I'm up down to 58 in quarantine from a high of a little over 200 a while back. Assaults continue to be at about 10% up since COVID stay-at-home order and the closure started, the essential business order started, and our burglary of buildings are actually up to 30%. But we are fully functional, fully operating, Mayor, and we're responding to all calls for service and our proactive measures to try to combat crime continue. And so if anyone needs us, please call on us, and that's my report.
Thank you, Mayor, for your leadership and also for providing the numbers to the general public every day so that they can track our statistics just like we are with the city. The Office of Emergency Management's been working hard on all the different task forces that we have within the city, making sure that everybody is providing proper information and getting proper personal protective equipment for the essential city services. I'd also like to thank Aramco in Saudi Arabia for their donations. Anybody else that would like to donate, we have an email that you can send, donations@houstonoem.org, and we'll be happy to set up some deliveries. The Office of Emergency Management's also doing our regular functions. We're monitoring weather this weekend. We're going to probably expect some rain today, but some more severe storms Saturday and Sunday. We've been in contact with HPD, HFD, and Public Works to make sure we have proper resources in place. Lastly, I'd like to let everybody know that this week is National Public Safety Telecommunicators Week. I'd like to acknowledge and thank our 911 operators, our police dispatchers, and the fire dispatchers for the service that they perform every day. Without them, our first responders would be a little bit less safe. So I want to thank all of our telecommunicators this week. We appreciate their service.
Thank you. And I want to echo that as well. That's why I was apologizing a few minutes late, because we were at, Chief Finner and I were over at the Houston Emergency Communications Center actually feeding lunch to our telecommunicators. And I want to thank Landry's for helping us with that, and then the Rockets that will help us with day shift on Tuesday. The one thing that I forgot to mention, Mayor, that we talked about this morning is, just a couple minutes ago, is that the White House actually reached out to us, the executive office of the White House, about 2 weeks ago and asked us if we need a hand sanitizer. And I want to thank the White House for 6,000 gallons that showed up this morning. So we've got 6,000 gallons of hand sanitizer, and I want to thank not just the White House, but UPS for delivering. Go Brown, thanks for getting it to us this morning. We're very happy, because that's one of the things that we needed. So thank you again.
Thank you, and we'll take any questions.
Mayor Turner, you were
Yes.
talking about looking at the governor's plan to get the Texas economy reopened.
Yes.
And you talk about, for the city of Houston, taking measured steps in the days to come. Could you be more specific on what you mean? What are specifically those measured steps that you're looking at right now?
The social, regardless of whether stay-at-home order continues, how long it continues, there are certain things that I think we can all agree that will continue for quite some time. The wearing of facial coverings, those things will continue. Social distancing will continue. For the city of Houston and for our, let's say, governmental operations, telecommuting, working remotely, that will continue. I've already advised our department heads that the policies that we're operating on now will continue through May. And so we'll continue to work remotely. We'll continue, for example, to do as much online. All of the city's operations will continue. So that's, taking a very measured approach. And then we're looking at the governor's executive orders and the ones that he planned to submit, I think, on April 27th. And then he talked about submitting something else in May. We'll take a careful look at those because overall the governor will set the overall parameters, but within those parameters we will determine what are the measured steps that we need to take in order to maintain the health and safety of the people in the city of Houston. In addition to that, we want to carefully talk to our medical professionals. We've worked with them from the very, very beginning, and we need to continue to work with them. because what we don't want to see happen is that you take some steps, go too fast, too soon, and then we end up finding ourselves looking at some peaks, some spikes that we could have avoided. So we just want to take a very measured approach as we move forward.
Do you agree with what you've heard so far from Governor Abbott, or are you in lockstep with his thinking moving forward?
I think that's a very strong. Let me put it this way: when it comes to closing schools for the rest of the academic year, I agree with that. I mean, schools already were going to be closed until May the 4th. Quite frankly, most schools were coming to an end in the month of May anyway, and so I agree with that. And in that note, a lot of seniors, for example, are missing out on their prom, except tonight. You know, I will be going to a prom tonight at 7:30. It will be a virtual prom with some other high school students. I'm just going to pop in on them virtually. So I agree with that. With respect to the state parks, I agree with that. Our parks are open. But we talk about social distancing and making sure that they don't get overcrowded. Those things I agree with. The testing has always been and continue to be the most important thing. And we need to hear a lot more on the plan for robust, ubiquitous testing. That's the critical piece. And for right now, for most of the testing, we're still having to wait 5 to 6 days to get the results. And so we need rapid testing where you can get the results much sooner, much more widespread and ubiquitous testing. And then at the same time, we need contact tracing, so such that we're not only using testing as a diagnostic tool, but we're using testing to determine who has it, and then being able to find out who they have been in association with to be able to isolate and quarantine. And we can be much more strategic. And then down the road, the testing for the antibodies. So the testing is the key piece, and that will determine how fast you can go, how quickly and in what stages you can open things up. And that's the piece where I think we require a lot more information, a lot more in terms of resources and assistance, but that's the big thing in the room. So I look forward to hearing more from the state on their planning. And having said that, we're all anxious to get back to business as much as possible. But I do think we owe it to every single person in our city, for example, who have made tremendous sacrifices, that we can give them some degree of assurance that as we take these next steps to reopen, that their health, their safety will be protected, and not only their health and safety, but the health and safety of those who they work with, or they associate with, or who they live with.
Chief Acevedo, I have a quick question for you. There was an incident, burglary of a building call at an apartment complex. Apartment complex security guard caught the suspect breaking into the complex's mailroom. Suspect is Terrence St. Clair John. There was a note in the computer to the arresting officers. They were advised by JPC that they would reject the defendant due to the current COVID-19 pandemic, and that they should just simply file a warrant. Is that a new protocol that you're aware of?
I'd have to look at the specifics on that case to see what the charges were that they sought. So
Criminal trespass. One
yeah,
count of
criminal trespass. We've been diverting,
and evading arrest.
but we've been diverting criminal trespass for a couple of years now through the Ed Emmett Center and our efforts to try to keep our resources in service, trying to disrupt crime. So I don't think that's something new. I'd have to check on that. If you can send me the information, I will. But I don't think that had to do with COVID. That just has to do with criminal trespass, especially if it's mental illness is involved. We've been doing law enforcement assisted diversions for quite a while now here in Harris County.
Thanks.
Yeah.
Mayor,
Yes.
Question from Fox. While we're talking about reopening businesses, the county just finished building a multi-million-dollar makeshift hospital outside NRG. Does this send mixed signals, or is this some type of resurgence?
Let me let me respond in this fashion. From the very beginning, both the county and the city, we've tried to be as proactive as possible in mitigating the risk of this virus. And we took steps early on to be proactive. We've looked at what has occurred in Washington State, in New York, and other places, and we did not want to get to those, to be in those positions. A lot of lives have been lost, and a lot of sacrifices were made. And so from the very beginning, just like the steps, for example, that we took as relates to the Houston Livestock Show and Rodeo, and at the beginning, for example, that was not a popular move at all. But it was an attempt to be proactive as much as possible. I think it's paying dividends for us. The same thing with suspending the business, restaurants, bars, and clubs. It was never popular, okay? But I think we've saved a lot of lives. And then the stay home, work safe order, same thing. I think what the county did in putting up the hospital is that at the point in time, things were going up, the numbers were coming up. We were seeing, the county and others were looking at what was taking place in other cities. And we were very sensitive to the fact, or the county was, that we could get to the point that the number of cases coming into our healthcare delivery system would be more than the capacity, and you didn't want to be kept sleeping at the wheel, so to speak. Because if that were the case, people would have been saying, well, you've seen what was taking place in other places, and why did you move to be proactive? It's always better to have done too much and then not need it than to have done too little and to find yourself in need. And so, let me just leave it like that. Look, I would love for people to be able to say that the elected officials and others went too far. I'll accept that, okay, rather than saying we didn't go far enough. And at the same time, when we're talking about how do we reopen things, I think it's very prudent and wise for us to be very measured in our approach, because this is a different type of challenge than a hurricane. With this particular challenge, I can't see exactly where it is. I just know that it's there. So that's the best answer I can give you on that.
A little more reaction to the schools closing for the rest of the school year. I don't know if you see a scenario where maybe there's less students in class when it does come back up.
Yeah, I agree with the governor in terms of closing the schools for the rest of the academic year. They were not scheduled to reopen until May the 4th, and most of the schools were going to be closing in the end of May anyway. And I don't think things have changed too much from when I was in, for example, in high school 10 years ago as a student. Because did y'all hear that? I know when I was in school, May was in many ways like one of those, it was like a throwaway month. It was already done by then. So for the health and safety of the students, their parents, their relatives and friends, closing the schools for the rest of this academic year, I can understand. The whole goal is to put us in the best position so that come the fall, students and kids hopefully will be able to go back to school and go back to their schools and their classes.
So when we're talking about reopening, do you now see the face mask being required?
Well, it's a strong ask, for example. There's a request that I'm making. The moment in which, let's say, were I to make it a mandate, I want to also have a plentiful supply of masks and face coverings to be able to give to certain individuals and populations who are more vulnerable on the lower social economic end and may not be able to afford them or have them. And so when you put in place mandates, a requirement, I think there's also a corresponding obligation on my part to make sure that we have resources available for those who may not be able to afford them or get them. And so that's for me. I'm not saying it won't happen, but the task force that I've put in place, for example, they are working on two fronts, education and looking for and providing resources to this at-risk vulnerable populations. I do know that regardless of what measures are coming, the wearing of facial coverings will continue to be a part of it here in the city of Houston.
So, Mayor, you're not anticipating requiring people to wear masks, a la San Antonio, like in the
Not right now, but I do know that it's important to protect other people, and that as I go around the city of Houston, it is somewhat discouraging not to see some people not wearing them, when they're playing dominoes, for example, or engaged in other social activity, and they're in groups and they don't have them on. So I do strongly encourage and recommend, especially if you're around people with diabetes, heart disease, lung disease, sickle cell, you name it. Immune system's low, they need to have on face coverings, or you need to have them on when you're in their midst. If we get to the point where they are mandated, where I decide to mandate them, I want to at least know that we have a bountiful supply to give to people who may either not be able to afford them or have them made, that we can make them available. Because for me, when you say mandate, I think there's an obligation on your part to at least have some things available that you can make available to other people.
The governor is opening up elective surgery on the 22nd, and then on the 27th, before even the April 30th initial deadline, he's having another news conference. It certainly sounds like he wants to open up the state as soon as possible. If he does say that on the 27th, are you prepared to open up the bars and the restaurants? Are you prepared for like the Houston traffic jams at rush hour and all those things? Or how do you see the city's timeline if that's not a timeline you're comfortable with?
Well, let me just say, he's the governor. I certainly respect that position. And the governor, if he says that restaurants and bars and clubs and other businesses are going to open, then he trumps my decision, my opinion, whatever it may be. He's the governor. And we all assume responsibility for the decisions that we make. The only point that I simply would my little opinion would be that this virus is still out here. And it's the testing. If you get to the point where you have widespread ubiquitous testing, and that's not just for diagnostic purposes, but contact tracing, and you have a good sense of where it is or when cases might appear and spike, that you can strategically go isolate and quarantine, we're fine. I think the misstep will be if you open it up and you don't have the widespread ubiquitous testing. Now, that's my view. Now, let me get out of this lane, and Dr. Purse, if you want to comment on it, you're the...
And Dr. Purse, if you can just also comment on the fact that the city hit its capacity yesterday. Mm-hmm. I know the county's still trying to evaluate theirs. They've only tested about half. They tested 700 yesterday, and they have like 1,200 capacity. They're not testing asymptomatic people yet. Mm-hmm. Are you talking about ubiquitous testing? Are you urging, do you think it's a good idea for everybody who has tests to test all asymptomatic people at this point?
Okay, so which question do you want me to answer first?
Whichever one you want to answer first.
All right, so let's stick with the first question first, the one that the mayor commented, and I completely agree with him. I want to remind everyone, we talked about this 2 days ago, I think, but remind everyone that when this began here in Houston, and we had quite a number of folks who were on that Egyptian river cruise, and they came back, we were able to quickly identify them, and in those cases, we stopped the virus. We were able to do that because those individuals, this is right at the very beginning of all of this. This is, some time ago. Probably wasn't that many weeks ago, but it seems like it was a long time ago. But they identified themselves as responsible individuals who were concerned about what was going on, not only with them, but what could potentially happen to their families and their communities. And they identified themselves, and we were able to stop the virus from that outbreak. Remember, that was one person who was on that riverboat cruise, infected not only most of the people on that boat, but also the crew of the boat, and then they infected folks on subsequent cruises. But the individuals that came back to Houston, we were able to stop them using traditional public health techniques. When we talk about reopening society, we really need to be able to do that every time the virus pops up again. So, being a little bit unrealistic on my part, but just grant me this for a moment, it would be ideal if we were able to get to the point where there was every morning when the When the mayor came, he said, we had 0 new cases yesterday and 0 deaths. And if we were to be able to somehow get to that point, that would be a great point for us to start, reopening society, if you will, because then we would be able, and have the ubiquitous testing that the mayor talked about. So then we'd be able to identify, here's a new case, isolate that case, here's the 7, 10, 15 people that need to be quarantined, and we'd be able to stop it again. So that's where, in a magical world, I would like to get. The challenge that we're going to have is that this is a city of 2.5 million people, right? And we don't have that much testing. We don't have enough testing to be able to do that just yet. We're moving in that direction, and more testing, and we need to hear from the governor what his plan is. I believe that he talked about ramping up testing, but we need to find out what those plans are. And then the last comment on that is that nobody has done this in 100 years, and certainly not in a modern society. And so the mayor mentioned the situation in Singapore, and if you look at the graphs from Singapore, they had a rise and it leveled off. And we need to find out exactly what happened. Singapore's got a different culture. There's a different, physical, geographic layout. But then all of a sudden, just recently, the numbers took off again. So we need to find out what went wrong there. Not that the government there did anything wrong, but something went wrong because their numbers have shot up just in the last week or two. So we need to pay attention and learn from everyone else's experience who's a little bit further down the curve than us. What was your second question? Sorry.
I was just talking about the capacity of the testing, like Harris County has not met their capacity. So,
Yeah.
and there's other places around the private testing.
Right.
Would it be your recommendation for people who have capacity and the ability to go ahead and start testing all asymptomatic, like what you guys are doing in the city?
Yeah, and so I'm not going to criticize what Harris County or anybody else is doing, because as we've seen, in our conversations, there are multiple links in that chain, and you have to have each one of them operating just right before you can get to the place where we are today. And we had troubles doing that, as you witnessed, right? But we got to where we are today. And so I'm not going to criticize anyone else, but I do think that because this virus has this really difficult characteristic in that it can infect people to the point where they start shedding virus, but they have no symptoms. At some point in the equation of getting the economy going again, we absolutely have to be worried about the asymptomatic spreaders, or else we're never going to get ahead of this thing. And so, exactly how we, the city of Houston, we're fortunate that we're at the point now where we can do that. And I would hope that eventually everyone else would be too, but it's going to take time. It's not easy. You witnessed how much trouble we had getting there. It's not easy.
My question to Dr. Pest, I think it's just a follow-up to what you may have heard and which was maybe stylistically avoided. Somebody talked about the governor talking about elective surgeries, and he intends that those should begin at this particular time. Now, the average person on the street or the population doesn't actually know the difference between elective surgery and emergency surgeries. Elective surgeries, when they are not done at a particular time, can lead to death. Some of this COVID stuff related to elective surgeries could bring their own problems. So what do you have to tell the community about this issue of the governor saying elective surgeries should be done? The hospitals also trying to triage and look at how this whole thing can be managed alongside our COVID response. Thank you.
Yeah. I think elective surgeries in some degree are a little bit in the eye of the beholder. So, for example, if I've got a really bad knee and I need a knee replacement and I'm in pain, I want the surgery, but I'm not going to die without it. And so that's probably an elective surgery. It's causing me to have pain and more problems, and the longer it goes on, the worse it's going to get. But that's probably still an elective surgery. Certainly if I'm having a heart attack and I need bypass, that's not elective. That's emergent. But if you have a patient who has a cancerous tumor that's growing, at some point that's a small tumor, and if it grows a little bit more and the doctors are monitoring it, and maybe there's chemotherapy or radiation involved, you may be able to hold off the need for surgery. But at some point, you're going to need to have that tumor operated on and removed. And so I think that we absolutely can trust our doctors to know what is going to be appropriate as the governor changes the recommendations about surgeries. And I think, certainly things like cosmetic surgery, I wouldn't expect to see those occurring soon. But I've given you a couple of examples of where people are going to need surgery, and it may be more or less elective, depending on where you're looking at it from. So the knee replacement and the person who can still get around, that's elective. The cancer patient needs to have a tumor removed. There's a lot of particulars. How big is the tumor? How fast is it growing? Are the other therapies working or not? And we have to trust our doctors to make, and the patients, in conjunction with the patients, to make the right decision there.
Let me thank you all. I do think it is important now as we move forward, and just like Dr. Peirce has spoken and stated his position, it is also now important to hear from the doctors publicly and not just from politicians. And the reason why I say that, the decisions that we've made, the decisions that we've taken, we made these decisions with the advice and the counsel and support of our medical community, the Texas Medical Center and the hospitals. And now when we're at this phase, this juncture, it's important to hear from our doctors, from the hospitals. They need to speak loudly now, because if, as elected officials, we make decisions and we end up worsening a situation that it appears that we were containing, controlling, then we all will end up paying the price. And I will tell you, in the city of Houston, we've asked people to make huge sacrifices. We've worked to be proactive. In spite of all, I think our numbers have been pretty good. And the people in this city have worked well and hard. And I don't want to see us having made these sacrifices and all of a sudden the numbers start to go up. And I know we have made decisions based on what the doctors, the hospitals, the medical community have said. And at this juncture, I think it's important for the people to hear from our doctors, from our hospitals, that now is the time to start opening up. The doctors, and I would encourage them to become a public part of this conversation and not just allow it to be a political discourse. That's important. And quite frankly, it's important to all of us to hear that. So let me go and get ready for the prom tonight. And it's a virtual prom, and you know, we're gonna boogie down, but we're gonna do it in such a way. Oh, you have to have a little humor in this day and time. Enjoy your weekend. Thanks. Oh, I also want to thank Comcast for making their 25 donations for the purchase of PPEs. Comcast, $25,000 donation. Thank you so very, very much. Thank you.
All right, Mayor Turner and his team today, and the mayor walking a fine political line in this press conference. If you were watching, you noticed, reacting to the governor's plans to reopen the state in phases today, the mayor saying that he agrees with the governor to keep the schools closed to the end of the school year, agrees with the governor to reopen state parks starting next week with social distancing, but pretty clear he does not agree with the governor about reopening some businesses. He said at one point, what the governor says trumps what the mayor wants to do, but we are all responsible for the decisions we make. The mayor saying he wants to see more rapid testing to make sure that we are over the curve here, flatten the curve with COVID-19, and also he wants to see more of those tests available out there for folks to know for sure what's going on. He says we don't want to stop what we're doing, all the sacrifices we've made for this last 4 to 6 weeks, if it means there'll be a resurgence in the virus and it comes back with a vengeance a second time. So the mayor clearly worried about that, didn't want to get too direct. He had to be asked a couple of times what he thought about the governor's reopening before he let loose with that. So we're going to break down everything that he says. We're expecting also a press conference coming up here in about a half hour from the county judge. Her reaction to what the governor had to say today and what she says about what will happen in the county. And we'll get to that at 4:30 on the 411. We'll take a quick break. The 411 will start right after this.
HOU Verify.
If you know anything about me, it's that I love two things, dancing and firefighters. So it would be a real quarantine miracle if I found a web video that included both of those things. Take a look what happened when firefighters from Laredo, Texas decided to do the Blinding Lights Dance Challenge.